It is my pleasure to introduce Dr. Anwar Islam, who is the inventor of the first bone marrow biopsy needle with core retention device. Dr. Islam practices hematology and oncology, and he is a clinical associate professor at the School of Medicine, State University of New York at Buffalo. Today, he is going to discuss his single-use core retention bone marrow biopsy needle.
Thank you, Joe, for the nice introduction. Bone marrow biopsy, as you can see here, plays a very important role in the diagnosis and management of patients with various hematological as well as non-hematological malignant conditions. Sometimes it is the only way to make an accurate diagnosis. There are several instruments which are used for obtaining a bone marrow biopsy sample. The largest specimens are obtained with Notter-Labhart and Burkhart's instruments. As you can see, these instruments have several components or parts. They are too complicated. They require assistance. They also require open surgical procedures, and above all, they cannot be repeated on the same site for at least 4 to 6 months, which is quite unsatisfactory. These type of instruments are hardly used these days except for Professor Burkhart's instruments, which are perhaps still used in Munich, Germany. Then there are other kinds of needles which are also used for obtaining bone marrow biopsy specimens. As you can see, these are straight hollow tubes with beveled or serrated cutting ends. They do not have a core retention device, and as a result, when the needle is withdrawn, the biopsy specimen slips out of the needle. These needles do not have a free space between the internal wall of the needle and the marrow core, and as a result, sometimes the biopsy specimens can get completely impacted within the lumen of the needle, and trying to force them out can produce specimens like this. And as you can see, these specimens are completely crushed and totally unsatisfactory for any histological evaluation. Then in the 1960s came the Jamshidi needle. He came out with the idea to provide a free space between the internal wall of the needle and the marrow core for easy delivery of the core through the proximal end. For quite some time, the Jamshidi needle appeared to offer the best compromise between the Notter-Labhart and Burkhart's instruments and other kinds of straight hollow needles. But in a large proportion of cases, the samples fractures while it is being extracted, and only the outer portion is retrieved. One of the important drawbacks of the Jamshidi needle is the fact that it also does not have a core retention device. As a result, when the needle is withdrawn, the biopsy specimen slips out of the needle, requiring a second or third attempt to obtain an adequate biopsy specimen at the expense of considerable pain and suffering to the patient. The conventional Jamshidi needle technique also requires some rocking or sculling movements or change in the direction of the tip of the needle. As a result, the needles are often bent and damaged. But one of the most important drawbacks of the Jamshidi and other kinds of similar bone marrow biopsy needles is the fact that when the needle is being withdrawn, the biopsy specimen sometimes start to slip out of the needle, as you can see here. As a result, when the needle is completely withdrawn from the patient's body, a portion of the biopsy specimen is caught and remains trapped within the soft tissue and skin, as you can see here. Here you can see an example of such an incident that has occurred to me on several occasions. Here you can see a portion of the biopsy specimen is hanging outside the body, while a portion of the biopsy specimen is trapped in the skin, soft tissue and fat. If this happens, this can be quite dangerous, as there is definite fear of dissemination of the disease outside the bone marrow cavity. To overcome most, if not all, of the disadvantages associated with the Jamshidi and other conventional bone marrow biopsy needles, we have designed a new bone marrow biopsy needle. The important feature of this needle is the carefully tooled distal cutting end of the needle with a core retention device. In addition, it also has a T-bar handle which provides a firm grip, smooth dome-shaped handle which rests snugly in the operator's hand, avoiding pain and blister formation during the biopsy procedure. It also has a fluted cutting end which is sharp and cuts the bony trabecule cleanly. It also has a trocar pointed stellate which helps easy penetration of the soft tissue and hard cortical bone. Now, because of the presence of this core retention device, a biopsy specimen is always retained within the lumen of the needle. It cannot slip out of the needle. Now, let me talk about our new single-use core retention bone marrow biopsy needle. Unfortunately, it has taken a considerably long period of time to develop and bring this needle into the market. The reason being, it was rather difficult to manufacture this needle in bulk and also in keeping with its most important and unique feature, the core retention device. We have now not only managed to do this, but we have also improved it by adding these outside serrations or flutes near the distal cutting end of the needle, which helps in cutting the hard cortical bone and also facilitates its entry into the marrow cavity. As you know, core loss has been a real problem using the Jamshidi needle and other conventional bone marrow biopsy needle. We were not only the first to recognize this problem, but we are also the first to solve this problem by developing a needle with a core retention device. As a result, when the needle is withdrawn, the biopsy specimen is always retained within the lumen of the needle. This is to show the actual design of our original core retention bone marrow biopsy needle. As you can see, it is rather difficult and complicated to manufacture. The whole needle had to be drilled from the opposite side to produce this internal step, which acts as a shoulder that prevents the biopsy specimen from slipping out of the needle. Now, many years later, the market has realized that the core loss is a real problem And to overcome this problem, several American and European companies have come up with their own versions of needles to capture the biopsy specimen while the needle is being withdrawn. This is the newer Jamshidi needle with their core capturing device. They call it a marrow acquisition cradle. As you can see, it requires multiple components or parts, almost 8 of them. It also requires multiple steps and several maneuvers to complete the whole procedure. And as a result, they have not only made the procedure much more complicated, but because of the introduction of additional components or parts, they have also made the needle much more expensive. This is another needle manufactured by MD Tech, which is now part of Argon Medical. They call it a core locking device. As you can see, it also requires several components and parts and multiple steps to complete the procedure. Now, to capture the biopsy specimens, these conventional single-use bone marrow biopsy needles requires either the use of a sleeve or a tweezer-like component, as you can see here, or a drain spade shovel-like component, as you can see here. This is the one used by the Jamshidi needle, and they call it a marrow acquisition cradle. These components are hard to push over the biopsy specimen when it is sitting inside the lumen of the needle. Sometimes they also cause fragmentation of the biopsy specimen, as you can see here. Now, these sleeves or marrow acquisition cradle, when forcefully pushed over the biopsy specimen to capture it, they not only cause considerable damage to the biopsy specimen itself, but it also produces significant crush artifact, particularly at the edge of the biopsy specimen, as you can see here. Now here you can see an animation of the whole procedure that I have just described. Here you can see that as the sleeve or marrow acquisition cradle is pushed over the biopsy specimen, it causes considerable damage to the biopsy specimen and also produces crush artifact, particularly near the edge of the biopsy specimen. This is the Goldenberg needle manufactured by Ranfuck, and as you can see, it houses an internally placed coil system. The idea behind this needle system is that when this lever is moved forward to on position, the coil is supposed to move over the biopsy specimen and to grab it so that the biopsy does not slip out of the needle when the needle is withdrawn. But as you know, bone marrow is quite delicate and a very soft and friable tissue. And as the coil moves over the biopsy specimen, it squeezes the biopsy sample and produces considerable crushing and artifactual change. Furthermore, because of the space it needs to house the coil within the lumen of the needle had to be made bigger in diameter, and as a result, one usually gets a smaller diameter biopsy specimen with a larger diameter biopsy needle. Here you can see an animation of the whole procedure using the Ranfuck needle. Here you can see as the coil is moved over the biopsy specimen to grab it, it squeezes the biopsy specimen and as a result causes considerable damage to the biopsy specimen and crush artifact. This is the new on-control bone marrow biopsy needle by Telefax and VitaCare. Basically, this is a battery-operated power drill. But to capture the biopsy specimen, they have attached a sickle-shaped hook near the distal cutting end of the needle, as you can see here, that projects into the lumen of the needle. As a result, when the needle is driven into the marrow cavity, this hook usually eats away the bone and marrow, reducing the total width of the marrow specimen for histological examination. This is the schematic representation of the biopsy technique using the on-control needle and our co-retention bone marrow biopsy needle. As you can see, the combination of this hook and the high speed of drilling causes considerable damage to the biopsy specimen and crush artifact, particularly to the edge of the biopsy specimen. On the other hand, the inside of our needle, as you can see, is quite smooth, and as you can see here, that there is nothing that projects into the lumen of the needle. As a result, when the needle is introduced into the marrow cavity, the bony trabeculae are cut cleanly and there is hardly any crush artifact even at the edge of the biopsy specimen. As a result, the total width of the biopsy specimen is available for histological evaluation. Here you can see an animation of the biopsy procedure using the on-control needle. Here you can see as the needle is driven into the marrow cavity, the presence of this hook and the high-speed drilling cause considerable damage to the biopsy specimen and also crush artifact, particularly near the edge of the biopsy specimen. Now this is our single-use bone marrow biopsy needle, and as you can see, it is very simple. Basically, it has only three components or parts: the needle, the stellate, and the pusher. The actual core retention device is incorporated within the lumen of the needle, and as a result, it does not require any additional components or parts to capture the biopsy specimen, such as the sleeve used by the Argonne Medical and many other conventional needle manufacturers, or a drain spade shovel-like component as used by BD and Carefusion, which they call it marrow acquisition cradle, or a hook used by the on-control needle, or any coil system that is used by Ranfac needle. As a result, our needle can be introduced and withdrawn with a straight pull. One of the unforeseen or unanticipated problem of this forceful introduction of the sleeve or the marrow acquisition cradle over the biopsy specimen when it is sitting inside the lumen of the needle, and the additional maneuvers that is required to capture the biopsy specimen may elicit added pain as compared to our single-use co-retention bone marrow biopsy needle, which does not require any such components or parts or any additional maneuvers to capture the biopsy specimen. Now the same thing can be applied to Ranfac and on-control needle. This is to show an example of a cortical bone, and as you can see, the cortical bone is quite hard. Although The cortical bone over the posterior ilium is not as hard as this one, but I can tell you from my personal experience that it is quite hard, and at times it can be very difficult to penetrate this bone even with a trocar pointed stilet. To overcome this problem, we have added these outside serrations or flutes at the junction of the narrower distal portion of the needle with its wider proximal portion. As a result, when the needle is rotated in a clockwise and counterclockwise rotary motions, these outside serrations acts like a saw and helps cutting the hard cortical bone and facilitates the entry into the marrow cavity. Now this is the schematic representation of the biopsy technique, and here you can see the needle with the stilet in place is introduced to the bone, and once the cortical bone is penetrated, the trocar is withdrawn. The needle is then advanced with slow, steady and controlled clockwise and counterclockwise rotary motions until an adequate depth is reached, which is about 20 to 25 millimeter. Once an adequate depth is reached, the needle is then withdrawn with a straight pull. No rocking, sculling or gyratory movements or change in the direction of the tip of the needle is necessary. Now this is the schematic representation of the biopsy technique, and here you can see there is a free space between the internal wall of the needle and the marrow core. Now as the biopsy enters into the hollow needle, it also expands to some extent, and this little step acts as a shoulder and prevents the biopsy specimen from slipping out of the needle when the needle is withdrawn. In addition, this free space not only helps in easy delivery of the core through the proximal end of the needle, but it also avoids crushing and compression of the tissue as well as plugging the lumen of the needle. Here you can see an animation of the whole procedure using our core retention bone marrow biopsy needle. Here you can see that there is a free space between the internal wall of the needle and the marrow core, and as the biopsy enters into the hollow needle, it also expands, and this little step acts as a shoulder that prevents the biopsy specimen from slipping out of the needle. Now once the needle is completely withdrawn from the patient's body, the insertion aid is attached to the distal cutting end of the needle, as you can see here. Then the biopsy specimen contained within the lumen of the needle is then pushed out of the needle by introducing the pusher rod through the opposite end of the insertion aid. This is to show an example of a biopsy specimen obtained with one of our core retention single-use bone marrow biopsy needle, and as you can see, it gives a nice, long and uniform core of marrow tissue with little or no distortion of the marrow architecture. Now, I would like to show you a couple of other minor but important differences between our core retention and other conventional single-use bone marrow biopsy needle. Here you can see the trocar pointed stilet of our bone marrow biopsy needle, and as you can see, unlike the trocars of other needles, it is quite sharp and pointed, and it really helps in easy penetration of the skin, soft tissue and the cortical bone. Now another problem with the Jamshidi and other conventional single-use bone marrow biopsy needles is the fact that they all have this plastic protuberance or projection at the base of the handle of the needle. This is used to secure the protective sheath that covers the needle during its transport. But as you can see, Such protuberance can cause much pain and discomfort and in fact hurts the fingers during holding of the needle during the biopsy procedure. On the other hand, as you can see in our core retention bone marrow biopsy needle, we do not have any such projections or protuberance, and as a result, the holding and maneuverability of our needle during the biopsy procedure is painless. Finally, the needle has been ergonomically designed for ease of use and operator comfort and predictably delivers an ideal biopsy specimen at each attempt.